Creating Healthy Places and Spaces, a collaborative approach event organised this morning by Public Health Wales. My name is Kate Eden and I'm Vice Chair and Non-Exec Director here at PHW, and I'm delighted to be chairing this morning. This event is all around bringing together planning and health professionals to enhance understanding of the potential that collaborative working can bring. Whilst today's event is very much focused on the planning and health systems in Wales, it's also great to see that we have many others of us joining from outside Wales, so a very warm welcome to you all. And today follows on from two previous events in previous years, pre-pandemic, facilitated by the Welsh Health Impacts Assessment Support Unit here at PHW, in which there was really positive engagement and recognition of the need for more integrated and joined up working. So feedback from those events suggested we could build on this further by facilitating some more practical support for planning and health professionals. And that's what we're going to focus very much on today. So a couple of housekeeping points before we start. Your microphones will be muted and cameras should be turned off at the moment. So we're going to ask you to keep those off during the presentation so our speakers aren't distracted. We are recording the conference, at least the presentation sessions, not the workshop sessions, and we'll make those available on the Public Health Network Cymru website after the session. Mae bleser gen I cyflwyno'r bod na'r isdailau Cymraeg ar gael heddiw. I'm very pleased to say that we have Welsh and English subtitles available today, and I understand that these can be switched on using the button on the bottom right of your screens. But we are aware that some of the auto-generated Welsh subtitles can sometimes be a bit inaccurate. So please don't hold us to account for any mistakes or inaccuracies that come through on that. But if you experience any difficulties with any of the technology today, please just let us know through the chat bar and the team will get in contact with you directly. And we're also going to be tweeting today via hashtag PHNC Places and Spaces. So if you're on Twitter, please go ahead and join us over there. So you should have received the agenda in your delegate pack. And anyone who hasn't had one, please just put your email address in the chat bar and we'll get one sent out to you by now. But the format of the morning will start with 4 presentations highlighting the importance of planning and health joined up working and some practical examples of how this can be done from across England and Wales. We'll then have a short Q&A following the presentations. And then after a break, the focus of the 2 workshops will be on supporting joint planning and health work within a very much a Welsh system context and reviewing some of the tools that have been developed specifically to support work in Wales. So those tools were included in your delegate pack. So if you don't have them, let us know in the chat bar, we'll send them out to you again. And I think we also put them at the top of the chat bar as little sticky notes as well. So you should be able to access them through that. But again, if you haven't got them, let us know. So the 2 workshops are primarily aimed at those who are currently working in Wales or want to work in Wales. But if other delegates do want to stay and observe those discussions, you're very welcome to do so. In fact, we'd love to get those perspectives, but you're also welcome to leave during the break if you do want to. And everybody's already been allocated to a workshop and you'll just be moved automatically into it at that appropriate time. So without further ado then, we will move on to the first session of the morning. And I'm delighted to welcome back Michael Chang, who's Programme Manager for Planning and Health in the Office for Health Improvement and Disparities, and Liz Green, Consultant in Public Health Policy and International Health, and Programme Director for Health Impact Assessment here at PHW. And Liz and Michael will provide an overview of the current issues facing our communities and places and the importance of collaboration between planning and health. So if you've got questions for any of our presenters in the following 4 presentation sessions, Can we ask you to put them in the chat bar, and we're going to pick them up in a short Q&A after the presentations, just before the break. So we're going to take them all as one big group. If they are questions for factual clarity, we'll try and answer them in the chat bar as we go along. But otherwise, we're going to break them up into broad themes, and we'll make sure they're answered by our presenters afterwards. Okay, and can I also just remind you, make sure your mics are muted while our presenters are speaking. So without any further ado, Michael and Liz, over to you, Michael and Liz. Thank you very much.
Thank you very much, Kate, and welcome to everybody. I'm just going to share my screen, and then Michael and I will talk to you a little bit about some of the work that we've done. Okay, can you see that? Michael?
Yes, yep, I can.
Great, lovely. Okay then.
Thank you. Thank you. Good morning, everyone. Thank you for the introduction, Kate. So I work for the Office for Health Improvement and Disparities here in England. So we don't work across the border, but we do work quite closely with Liz and other UK nations on this agenda. The office and the Healthy Places team in which I work in will focus on improving nation's health so that everyone can expect to live more of life in good health, and on leveling up health disparities to break the link between background and people's prospects for a healthy life. So that's our kind of work for now. In terms of my presentation, next slide, please, Liz. I think you will see in our work, there's a lot of focus on place, and the place word is being used quite a lot in the work across the office and across the UK at the moment. Next slide, please, Liz. Yeah, thank you. For place, there'll be a lot of focus on disparities and geographies of place, and that's, I think we should be focusing on that, and that's where planning can have great influence over the spatial elements of the agenda. People looking at who we're planning for and the environments that live, work, and play, that's quite important, because if we're not planning for people, who are we planning for? And then finally, linking that to health inequalities and the health challenges that people face in their communities, whether they'll be an elderly population, mental well-being, and all those issues that we're currently facing across the UK and internationally as well. The planning system actually is a conduit for delivering some of these priorities, and often people will say the planning system is there to do a certain thing, but actually the planning system is there to serve. So it's form follows function rather than function following form. So I think that's where we should be focusing on efforts around the planning system and public health issues at this point in time. Next slide, please, Liz. Thank you. So in terms of the work that we are looking at now, I think there's definitely a need to focus on the practical elements of planning for health, and that is about supporting practitioners and the systems and in the way that they shape the environment and that they upskill themselves in order to plan for the priorities that I just mentioned earlier. So it requires people and practitioners across the different professions to understand and have a working competency in the arts and the legal and the political science of planning for health, and that requires a different type of professionals and CPD requirements going forward. Next slide, please, Liz. Thank you. So in terms of what we're looking to achieve from the Planning for Health agenda in general, not just in England, but across what we're doing in general, is to provide greater clarity and tangible clarity about what physical and mental health and well-being means in the environment and planning. As soon as we can provide clarity and tangibility, that's where the planning system can really be effective. We want to increase the coverage of health promoting policies across the different planning processes and tools. And I know you will have the workshops later on this morning on what you're doing in Wales. Supporting local systems to take planning decisions for those people in areas who need the planning system the most. So taking the health impact assessment approach is really quite effective. A better understanding of spatial inequalities, and that's where I said earlier, the focus on place is really quite important, because we do want to know who we're planning for, where they live, and the interactions between people and place. Finally, I'll emphasize the need to build a very competent and sustainable workforce, as I said earlier, and I'll be holding an event later on in April to explore the workforce issues around planning for health, and Liz has kindly agreed to speak at that event as well. So please look out for that in the coming weeks for details. My final slide really is just trying to kind of lead on to Liz's presentation about about how we are achieving some of these issues in England and across the UK, but primarily in England. The left column is a piece of work that we did at PHE with the University of the West of England to explore the challenges and barriers to planning for health back in 2018, 2019, 2020. And the right column is where we've made some progress, both in terms of the proactive work of Public Health England, but also in general across different stakeholder organisations and local authorities. I'll highlight 2 or 3 of these, not all of them. Firstly, the first one, existing evidence is not translatable to practice at a local level. And I think that's something that we've been very mindful of, that actually many of the public health evidence, academic literature, we can't quite use in the planning system. And we're not quite tangible enough about what we want to achieve in the planning system. And so what we're doing now in the Office for Health Improvement is trying to develop a Healthy Places framework for England that provides a framework and reference points for local authorities, developers, whoever it might be, developing healthy places, about what they could be achieving based on evidence in literature and public health. And then finally, looking at the disconnect between the government agencies and those providing leadership and activities around planning for health. Obviously, OHID was set up from October 2021, replacing Public Health England, and that's where we will show leadership in terms of the focus on health and the disparities in other areas of the place environment as well. Office for Place was set up in England within the main department for the planning system here in England. That's very much looking at improving design quality across the whole of the system and departments as well. And then finally, the Health Promotion Task Force, which is the cross-ministerial task force looking at some of these issues in England. And you can find the membership on the gov.uk website, and I'm sure they'll release more information in the coming days. So that's where I'll finish. I hope that gives you a really quick context and background to what we're doing, what we will be aiming to achieve around planning for health. Any further information you can access the Knowledge Hub in the next slide or the Health and Wellbeing Planning Network. Over to you, Liz. Thank you.
Okay. Sorry, my laptop seems to have decided it doesn't want to play ball with me this morning. There we go. Right, okay, so hopefully you can see that. Can you see that, Michael?
Yes, yep, go ahead.
Great. So Michael talked about some of the work that's happened pre the pandemic and some of the opportunities and where we might want to focus our attention going forward. But I'm just going to talk briefly, not about our work in general within Wales, because we've got a number of examples where people will be able to talk about that and the UK more widely. But I'm just going to have a look at actually what COVID and the pandemic has actually meant in terms of spatial planning and health. And so Public Health Wales carried out a health impact assessment on the lockdown measures in 2020, looking at the first lockdown, and planning and spatial planning and those spatial planning determinants of health, such as housing and transport and active travel, all came through very strongly. That actually they could, the way that the lockdown and the pandemic has played out could enable physical and mental well-being, or it could inhibit it through the spatial planning system. So we decided it would be a good idea to have a deeper look at this, and we started pulling together some evidence and have produced a report that was published on Monday called Maximising Health and Wellbeing Opportunities for Spatial Planning in the Recovery and the sort of renewal post the pandemic. So it was a literature review, really, of journal papers and peer-reviewed evidence and grey literature. But also we set up a strategic advisory group that was multidisciplinary, cross-organisational, cross-sector. Michael kindly agreed to be part of it as well. So it gave us a holistic perspective as well. And what we identified as part of that report was actually there were no new surprises in terms of the key issues, but also we did find some more interesting insights and some examples of good practice that can add to the evidence base. But also the aim of this work was to sort of look at any opportunities for collaboration, for collaborative working, and actually what could be those key drivers for that going forward. Oh. Right, okay. So one of the key asks of the strategic advisory group was that they wanted us to kind of look at key emerging trends and data and evidence, which is what Michael just referred to, it because it's very important for all of us, for both public health, but also for spatial planners, and who was actually going to be affected or had been affected by the pandemic through some of those spatial determinants of health. And actually, you know, where they, in terms of inequalities, are these the sort of areas and the groups that we need to look at and use that lens. So there was very clear sort of examples around those on low incomes, the differences between those who lived in areas of deprivation or who may have chronic conditions, and how they fared within the pandemic in terms of housing and transport, the ability to access services, compared to more affluent communities or those who may be in better health. Also, there was a very clear examples around the differences in where you live in Wales, around the sort of urban and the rural split. And in terms of rural communities, they may have had better access in terms of being on the doorstep to green and blue infrastructure compared to communities in urban areas, but actually trying to access those and get to them in some respects was much more difficult through public transport, etc. So it was very interesting, and one of our key things was that actually communities who'd invested in social cohesion had actually sort of come together to try and work through some of the issues of lockdown and bring each other together when it was allowed under the regulations, like walking groups and things like that. They actually fared much better than some of the other communities in Wales. The emerging themes, so this big difference in inequalities across Wales, which is nothing new again. And you'll look at these emerging themes and you'll think, well, again, we kind of know that, but what do we do about it? How can we try and factor in what's happened in terms of the importance of accessing green and blue infrastructure, for example, to not just keep yourself physically healthy, but also it has a huge important protective factor in terms of your mental well-being as well. Being out in nature or taking activity. You know, if you had if you lived in a house with a garden and you could access that garden through lockdowns, maybe create you know, some herb gardens or do a bit of gardening, you fared much you fared much better than those who lived in a small flat with no balcony. It might be you know, several flights of stairs or whatever. So there are clear distinctions about how things like the land use planning system in terms of accessing local facilities and retail was very important, and the nature of that and the cost of that and the supply of the supply of food and healthy food and how you could access that in terms of the pandemic. We found that repeatedly local foundational economies came through very strongly in the literature and the grey literature and the people that we talked to about actually how they can help us come together to create healthier spaces and places for people in a post-pandemic space. So about things like collaborative working between public health and spatial planners and communities to have community and health services hubs, for example. And we all know the importance of accessing digital infrastructure because, for example, this is where a lot of us are at home today, and we are all using new and innovative different platforms every day to enable us to work, have our leisure, and connect with friends, family and society. So it's about how do we use those as well in a much more effective way. So some of our future opportunities that we identified, Welsh Government actually has ambitions around the placemaking charter that organisations and public bodies can sign up to in order to try and enable better health and wellbeing through spatial planning. And vice versa. Welsh Government also has an ambition around local foundational economies and home working and how we can make that better and sort of enable people to feel better in themselves and mitigate for any unintended negative impacts. One of the clear themes was the important role of the health sector in planning decisions. And when I say the health sector, I don't just mean healthcare services, but I mean public health systems as well. And practitioners such as myself or Michael or some of the Public Health Wales colleagues or yourself in local government and other organisations. And that actually public engagement, as much as stakeholder engagement and early involvement, can actually help through tools such as health impact assessment to try and work through any challenges that may be at a national or local level. I'm very aware there are other tools and strategies and guidance out there. For example, Scotland has the place standard. Wales firmly roots itself in HIA in terms of a public health perspective. But I'm very aware there's a lot of different tools that you can use to engage different sectors and your communities, our communities, in order to try and enable health and wellbeing. And also developing tools and resources that may have guidance, for example, that have thresholds around health and wellbeing, around, you know, what are we going to look for in future planning applications and policies. For example, I referenced housing. So a lot of us are working from home, but many of our houses aren't set up for home working. So we have to look at our future needs through what we've learned now. So that's just a very quick overview. The report is out, it's published on our website. There are our links, it's in English and Welsh. If you want any other information, you can contact the team or look at our website. And just when Michael talked about the book that we're hoping, or we will be publishing in September of this year, and there's just a quick preview of what the cover looks like. So and we hope that that book will be of use to many of us and across the UK and beyond. So thank you. If you've got any questions, then please do feel free to ask.
Diolch yn fawr iawn. Thank you very much, Michael and Liz, for that overview on what's been happening across England and Public Health Wales over the past couple of years. Those publications that Liz mentioned are on our website. I'm sure we'll put them in a link on the chat bar as well. And we look forward to the book coming out in the autumn time. So as Liz said, just a reminder, if you do have any questions, put them in the chat bar and we'll respond to them after the presentation. But we'll turn now to our second presentation of the morning, and I've got very great pleasure to introduce Lydia Orford, who is the Principal Public Health Practitioner in the Public Health team in Betsy Cadwallader Health Board. We were also due to be joined by Cheryl Williams from the Cardiff and Vale Public Health team, but unfortunately she's unable to be with us this morning. So Lydia, I understand that you're going to pick up on Cheryl's slides for her section as well. So thank you very much for that, and I'll hand over to you. Diolch yn fawr, Lydia.
Great, thank you, Kate. Can everybody hear me? And I'm just going to share my screen now. Sorry, having technical problems.
I think we can see your first slide, just not the full slide view yet.
There we go. Is that better? Lovely, thank you. So thanks everybody, and thanks for the opportunity to present today So as Kate said, I am the Principal Public Health Practitioner in the Betsy Cadwallader Local Public Health Team, and I'm now going to present on establishing planning and health relationships. I'm part of the Healthy Weight, Healthy Wales whole system approach team, and there is a Wales-wide team across Wales. So here in North Wales, planning has been identified as one of our initial priority areas for our whole system work. But prior to my role here at Public Health Wales, I worked in the public health team for Cheshire West and Chester Council, just across the border in England, where public health now sits within local authorities. And I've been asked today to speak to you regarding the work I did with the planning team, specifically with development management over in Cheshire West and Chester. So this presentation will focus on joint working opportunities between public health and development management. We'll outline the development of a health impact statement in Cheshire West, and we'll showcase 2 case studies that illustrate this joint working. So there are a number of opportunities for public health and development management to work together during the planning process. So at pre-application stage, so we can offer advice around the need for a development, offer data on the local area, highlight any initial health concerns, and confirm if a health section 106 would be requested. At full application stage, we can respond from a public health perspective to that application, confirm whether a further in-depth HIA would be required, and again, request for health 106. We can also offer ongoing support and advice, and all are a two-way process with both public health and development management supporting, advising, and learning from each other. So within Cheshire West, public health and development management work together to produce and implement something called a health impact statement. And the development of the health impact statement was outlined in our local plan part 2 for Cheshire West, and it sets out what is expected from an applicant. It's a way of ensuring that health is considered in the application, and for public health then reviewing the application, it ensures all of the health information is in one place. The health impact statement is completed at validation stage and submitted alongside the other supporting documents for the application. In Cheshire West and Chester, a health impact statement must be completed for all major planning development proposals. So in Cheshire West and Chester, that's defined as 10 dwellings or more, or 1,000 square metres, and that will be reviewed. But initially, a health impact statement was for all of those major planning applications. The areas covered within the health impact statement in Cheshire West and Chester were around transport and public service accessibility, green infrastructure, health and wellbeing, and open space, sport and recreation, and also housing. And the reason that these areas are covered are those are the ones within the local plan part 2. So if we want to encompass other areas within the health impact statement, they'll need to be added into the local plan when it's at its review stage. So the health impact statement includes a template table, and you can see that there on the slide, that should be submitted as part of any information provided in support of the major planning application. I've popped a link there on that slide, so you can have a look at the health impact statement on the council website. And if you wanted to look on the planning portal, you'd be able to see if impact statement as part of their application. So the health impact statement is essentially a desktop HIA, and therefore in certain circumstances further information or assessment may be required, especially where significant impacts are likely. But what we were finding within Cheshire West was that every major planning application would fill in a health impact statement, but there would only be a handful that then would need to go on to fill in a full HIA. So it was a way of us ensuring that health was considered within each application, and as I said, really gave a simple way to public health then to be able to respond to that planning application, because all of the information we would require would be within the health impact statement. So I just wanted to give a couple of examples of how this joint working between public health and development management was seen in fruition really within Cheshire West and Chester. So this first case study illustrates joint working for a residential development. So this was a 13-hectare site for 395 dwellings. The health impact statement was submitted to support the application, and a health section 106 contribution was requested by the CCG, so the NHS over in Cheshire West. So the health impact statement outlined all of the health information, as I said, in one place. And in this application, it highlighted the cycling and walking opportunities linked to the site, but also highlighted where some requirements were missing from this application, such as EV charging infrastructure in this application. And we were able to therefore address that. Completion of the health impact statement also signposts to other submitted documents that may have further information which would be beneficial for public health to review, such as a sustainable construction statement. As I said, the NHS did request a 106 for this contribution for this development, and they reviewed GP surgeries within the catchment of the site and gave a detailed description of the capacity and existing infrastructure. The requested contributions are broken down by dwelling type, so 1, 2, 3, 4 bed, and response sets out how the 106 request is necessary, directly related to the development, and reasonable. The second case study that I wanted to showcase is for a change of use application from an A1 retail to an A5 hot food takeaway. So for this particular application, public health raised concerns relating to health challenges within that area, so specifically around obesity, deprivation and self-reported health for the area. Also the proximity to educational settings, so this particular application was within less than 1 mile from a youth centre, a secondary school and 2 primary schools. And the third concern that we raised was around the proximity to existing hot food takeaways within that small area, and therefore the proliferation of hot food takeaways in a small town centre area. So for this particular application, it was refused on health grounds. The case officer felt that the proposed development, so used the concerns raised by public health. So the proposed development was in close proximity to a number of schools and near to a number of other fast food takeaways, and in an area which has been shown to already have significant health challenges, which would be compounded by this development. They felt that no information was provided that demonstrated how health and wellbeing had been taken into account. And as such, cumulatively, the development will give rise to a significant adverse effects on health and wellbeing. Really importantly, this was in conflict with the provisions of the local plan and the local neighbourhood plan. So specifically refused on those grounds. I haven't been asked to cover Cheryl's slides, but I know that they will be available on the website after today's session. So I'd just like to thank you all for your time, and I hope this presentation gave you a flavour of the work that public health and development management can do when working together. Thank you.
Diolch yn fawr iawn. Thank you very much, Lydia, and sorry for setting you up there to present Cheryl's slides as well. They are available on the website, so you'll be able to go and have a look at some of the examples from the Cardiff and Vale Public Health team on the PHW website. But thank you very much, Lydia, for giving that overview and some of the really interesting case studies there. So thanks very much to the questions that are coming in the chat. Keep them coming in and we will collate them for later on. But I'm delighted now to welcome Tim Gill to the conference this morning. Tim is an independent researcher and a global advocate for children's play and mobility. And he's going to share some thoughts on planning and designing for children next. So thank you very much, Tim. I'll hand over to you. Thanks.
Thank you very much, Kate. I'm hoping you can hear me. I'm hoping everyone can hear me. I'm going to try to get the technology to work for me. So I'm also hoping that you can see a nice aerial view of Cardiff. And you can see that the title of my talk, I suppose, is the thinking behind this talk is that if we take a longer term collective view of the sort of moral and political basis of how we design and shape cities, then that can help us to get better outcomes, not just for children, but for everybody. But that seeing cities through the eyes of children helps us to do that. So we're often used to seeing plans and talking about planning from sort of the helicopter view, as with here. But of course, we don't live at the helicopter view, and children don't. We live on the ground. We experience urban life at ground level. And we also, children and families don't live in cities. They live in neighbourhoods. And so one of the messages of my talk is that we really need to think more about the neighbourhood as the kind of unit of analysis for our work on planning and design. And finally, when we're thinking about children's spatial lives, I think one of the things that's useful is to think about our own childhoods and the kind of relationship we had with the places around us when we grew up, and about how that's been changing. And my next slide gives a nice illustration of that change. So what you're looking at is a map that shows what you might call the roaming range, or the kind of home territory of 4 children. And they're all 8 years old, but they're in 4 generations of the same family, and they all grew up in the same city. So that big blob that you can see that takes up most of the map, that's the roaming range of the great-grandfather in this family. So at the age of 8, he could go 6 miles across the city on his own. And then you can see how the circles shrink with each generation until you have the yellow dot at the top left here. That's the son in this family just a few years ago. So 3 generations later, he's actually allowed to go to the end of his street. Now, we know that's more of a right to roam than most 8-year-olds get these days, so more or less confined to their homes and gardens if they have them. So what this illustrates nicely is what I call the shrinking horizons of childhood. And I think it's a profound shift, and it sort of opens up conversations about planning and design and their relationship to our lives. And that one of the reasons why this change has happened is because of the way cities are planned and designed. So I'm going to look a bit more about what I mean by this idea of child-friendly urban planning, why I think it matters, how it helps, a little bit about UK policy. So first, what is child-friendly urban planning? Well, it's a concrete vision for creating healthier human habitats. And it's a synthesis, which I offer in my book, Urban Playground, of some ideas going back several decades. But at the heart of the idea is a kind of framework of the spatial qualities that make a place child-friendly. And you can see that 2-dimensional framework in this diagram here, that it's about both levels of child mobility and about kind of offers and facilities and spaces within a neighbourhood. So it's got a public space focus and looks at mobility. So let's just talk about this 2-dimensional framework and a bit more detail. So you can imagine places or neighbours being graded along these 2 dimensions around the mobility axis and the things to do axis. So if you're a neighbourhood has very little to offer and it's very difficult to get around anyway, then you're in the cell, you're in that kind of bottom left quadrant. You might be in a place where there might be quite high levels of child mobility, but any children who can get around will just find a very boring and sterile environment. And an extreme example might be a refugee camp such as this one in Jordan. Conversely, you might live in a city where there's actually spatially a lot to do. And I visited the city of Recife in Brazil. You can see the aerial here. But in fact, so families, middle-class families, live in large numbers in these high-rise apartment blocks, and they're just a couple of blocks back from this lively beachfront that's common to many Brazilian cities. But But for the families who live in that apartment and for the children who live there, their spatial lives are so constrained and they're so dependent upon adults for moving them around that the beachfront may as well be many miles away, and they're in effect growing up in a glass house. So it's only where you have high levels of child mobility, so it's easy for children to get around, crucially, of course, on foot or by bike, and where you have a variety of offers of activities and spaces and places that you're in that child-friendly quadrant. So I'm just going to flesh out that vision a bit more. That last image comes from this district, which is the eco-suburb of Vauban in Freiburg, and you can see an aerial view of it now, but also one of the streets down, if you like, inside this area. And the crucial thing about Freiburg, about Vauban, is that it, as well as being sort of medium density apartment living, master planned, it is to all intents and purposes car free. So this means that the whole of the space between the buildings, the public space, is made available for public benefit. And here's an example of one of the green spaces. One of the interesting things about Vauban is that it doesn't really have segregated play areas. It's woven play offers into what is already a very sort of green and convivial public realm. The streets are lively and active and obviously support walking and cycling. There's quite a variety of different types of public space. They're thinking, and you can see design elements for children of different ages, with and without families. And I've been lucky enough to visit Vauban twice, and the level of activity in the open air in this district is extraordinary to see. And here's a couple of images. That is indeed one of the car parks where, if you own a car in Vauban, and not many families do, that's where you have to park it. And there is also very good public transport to the rest of the city. So that's the kind of concrete picture I want you to have in your mind. And if you like, a lighthouse or a sense of the direction of travel. Now, I pull that together in a sort of diagram in the book. I'm not going to talk about this in detail, but in essence, what you've got is a sort of basic framework which is familiar to those in favour of sustainable, compact urban planning. A child-friendly layer of additional design and planning elements that really enhance the qualities of this neighbourhood for children. Now, in my book, I was drawing on some case studies from cities that have taken this vision and this idea seriously. They may not be particularly child-friendly right now, but they have invested serious time and money and energy into becoming more child-friendly and going beyond just pilot studies and one-off engagement exercises. You can see a list of them there. I'm not going to talk in any detail about any of them, but I do want to share with you some of what I was interested in was why is it that these cities decided, and why did the municipalities decide to get interested in this topic? And when I spoke to city leaders, I found that the cities I looked at fell into three broad groups around their own rationale and interest for child-friendly planning. So there was a group of cities that were primarily interested in children's rights, children's health, so outcomes for children. And you can see that in this circle of cities here. There was a group of cities that were interested in the connections between child-friendliness and sustainability. And really this insight that if we ask ourselves what a child-friendly neighbourhood or city looks like, it looks a lot like a sustainable one. And then there was a third group of cities, in some ways the most interesting, who saw hard-nosed economic and demographic reasons for being interested in how cities are for children, and that they grasp this insight that a city that is not able to attract and retain families is a city whose long-term economic prospects are bleak. But one final takeaway from this Venn diagram is most of the cities that I looked at saw multiple reasons for engaging in this. So there were win-wins on offer, and I think that's a real something that a strong reason for looking at child friendliness. I just want to say a bit more about some of these aspects, and I want to talk about child health, and we're talking at a public health seminar. It is clear that poor planning harms all of us, but harms children more than others, and at the extreme can be devastating for families. And I'm speaking to you from London, where, and I take no pride in this at all, where there was an inquest a year or so ago that found that poor air quality was a causal factor in the death of an 8-year-old child. And this is, I think, a shameful fact for any so-called developed city in the 21st century. We also know that traffic and road danger is the leading cause of death around the world. It's a huge problem, but even in high-income countries, it's still a significant cause of fatalities of children, as in that statistic from Sweden. And we also know there are very high social inequalities, with poorer children at much greater risk than more wealthy ones. On a more positive note, we know that there are strong connections between the quality of children's spatial lives and their well-being. So this is some statistics from UNICEF that showed that across a range of different countries, those children who were able to play out daily had significantly higher happiness scores. So this is big data sets looking at their subjective well-being, and higher levels of subjective well-being than children who are able to play out only rarely. So there's a strong public health evidence base to support this vision of child-friendliness. We also know that this vision fits well with what children themselves tell us about what they like and what they don't like about where they live. And I think a pretty close mapping between children's views and this concrete vision that I'm offering. So if you pull it together, you have the idea that I think is nicely encapsulated in this quote from Enrique Peñalosa, the former mayor of Bogota, who transformed that city, which is this idea of children as being an indicator species. And if you think back to that district of Vauban I talked about, I think that's an example of actually this is not just a sort of figure of speech. It's literally the case that a neighborhood or a district where there are high levels of children out, active and visible in streets, different ages, with and without their parents, is a sign of the health of that habitat, in just the same way that seeing salmon in a river is a sign of the health of that habitat. So where are we in the UK? Well, of course, the planning system is devolved, as is public health, as we've just heard. There's a useful report from the RTPI that dives into this detail in the 4 nations. I'm just going to say a little bit about Wales. I think Wales is actually quite well placed. There's some helpful policy documents and resources in Wales that I would be very happy to see in England, but we certainly don't have them yet. I am just going to talk a bit about London. London does have a clear spatial plan with a policy about child-friendly planning. You can see the bullet points there. This has been evolving over 10 years or more. I was involved in the original version, and I think it's a useful case study. It's been recently strengthened, and this is now actually part of the London Plan itself. It used to be separate guidance. I'd like to know more about the kind of impact on developments of this policy, in particular this quite strong benchmark quantitative standard, this requirement to create 10 square meters of playable space per child. But I think it's a useful thing for those of you working at the municipal level to have a look at. And just a flavour of some of the things that have been happening in London. On the left, we have a rather intriguing Play Street. So this is a former street that's been pedestrianised as part of a regeneration project in King's Crescent in Hackney. On the right, you can see a quite adventurous play space as part of the Queen Elizabeth Olympic Park in East London, just down the road from where I live. Right in the heart of the City of London, this is a high profile, this is before and after images of Aldgate Square, one of the more prominent public spaces in the City of London that's been really transformed to be a sort of multifunctional public space. And interestingly, this project is right outside one of the few primary schools right in the heart of the City of London, and children from that school were involved in the planning for this project. A couple more projects from a regeneration programme in the EC1 area of London. This is a new housing development in in Ipswich that takes some of the same ideas from Vauban about taking cars out of the picture. just turning to Wales, a couple of examples. This is a very small scale one from Park Pulis in Conway. A really nice retrofitting of a social space outside a school. And at a much bigger scale, I'm working with Cardiff City Council on their approach to child friendliness, and we're going to be, and I'm interested to hear about developments like this one, the Curran Embankment in Cardiff, which again, like Vauban, has ambitions to take cars out of the picture and get the public realm doing a better job. So very briefly, some thoughts on making it happen. I say a lot about this in my book, but I just want to pick out a couple of points. One is that I think policies, of course, are important, but people are perhaps even more important. When I say people, I mean municipal officers who make things happen. And I also think this is not a technical challenge. This is really ultimately a moral and political challenge. And that's picking up on some of the comments that Michael made earlier. I offer in my book what I call a hub and spoke model for implementing child-friendly programs in cities. I won't talk at it in detail because time is running short, but at the heart of this implementation model is a municipal official. And time and again in the cities that I visited, what led things to happen and led progress and momentum to be built up was an engaged, effective officer. But I just want to pick up that moral point that a children's lens, I think the strongest case for bringing a children's lens to planning is that it helps to build a long-term collective vision of the direction that we need to go in to make cities work better. And that, as this quote from a Norwegian civil servant points out, that thinking about children and their experiences of the city helps to sugar the pill. It helps to build the case for measures that we know we're going to have to make to create more healthy, equitable, inclusive and sustainable cities. Thank you.
Thank you very much indeed, Tim, for taking us on that global tour and showing us around some really fascinating examples of what can be achieved when we work together across sectors. So thank you very much for that. And next, I'm delighted to introduce Sophie Patterson. Sophie is Community Investment Advisor from Waits Residential, and Waits is a privately owned construction, residential development and property services business. And Sophie's going to present now some intergenerational planning and design work that's been going on here in Cardiff. So over to you. Thank you very much, Sophie.
Oh, thank you, Kate. Can everyone see my screen that we've got? I'm just going to share the slides a moment. 1 second. That's better. So thank you. It's great to be here today. So yes, I'm going to talk to you about our Healthy and Informed Connected Communities project in Michelstone, which is on the former Michelstone College site in Ely in Cardiff. So as a starting point, I took the Move More, Eat Well plan and the Reimagining an Ageing Population report of 2019, which were both produced by Cardiff and Vale University Health Board. The reports focus on priority area, pledges and themes respectively, and this gave me an inspiration to integrate as many of those as possible into the project. It was an opportunity to get everybody thinking about ways to improve lives as a community develops. The 6 pledge areas from the Move More, Eat Well plan that I considered relevant are highlighted in green on the slide, and the Reimagining an Ageing Population have 3 themes, as you can see at the bottom of the slide, and they were at the heart of what we were trying to achieve. So what were we trying to achieve? After discussions with my colleagues at Waits and the architects and Cheryl Williams and our council client, we decided to create an intergenerational programme for people ranging from 3 years old right through to 65 plus. One of the objectives was to give them the chance to see how the design and planning processes work and how they could have an influence on the final development that was being built. As part of that design, there was a wellbeing village, which incorporated a plaza, which will be the central area that people can meet, socialise and take part in activities. This linked in beautifully with the inspiration I found in the previous reports. The sessions were held every Monday afternoon at the Ely and Cairo Integrated Children's Centre, which very conveniently was adjacent to the actual site. As you can imagine, we had to prepare to be adaptable in the face of COVID, and some of the interactions included virtual elements, especially with the older people's group. I think it's important for me to note here that reflecting back on the project, they struggled the most with engaging with the project for two very clear reasons. Firstly, as with any form of construction development, it means change for a community, and not all of the Wheatley Road tenants joined us from the very beginning, and unfortunately misinformation was spread, and they were under the impression that if they engaged with us, that would automatically mean that they'd be moved into the new development once it'd been built and they'd lose their existing homes, which completely wasn't the case. Secondly, COVID played a huge part in them not wanting to mix with young people, as the cases in schools were on the rise in the last 3 months of last year. And this was completely understandable, and we fully respected and supported their decisions not to attend in person, obviously. To remedy this, we set up Teams meetings to get their input, which at times proved a bit tricky with technology, but we persevered and we were able to gather some great ideas from them for the development. So every week for roughly about 10 weeks, we spent 2 hours working through focus sessions, which each had a specific theme to them. The participants worked with a mixture of public bodies, private companies, and third sector organisations. The sessions were really fun and interactive with lots of positive feedback on the ideas that they came up with. And we also had to manage their expectations so that everyone didn't get too carried away. It was also a chance for the young people to see some of the lesser known roles in construction, which helped give a very positive impression rather than the stereotypical rough and ready idea that sometimes we are labelled with. As you can see here, we worked with quite a wide range of key partners to deliver this project. We've got council representation there. We've got obviously the schools and the older persons group through the Cardiff Community Living Scheme. We've got our partners, Powell Dobson Architects, PRP Architects, the Tier Collective, who are our landscape architects. We've got Play Wales, we've got Sport Cardiff and Grow Cardiff as well. Here is just a snapshot of our overall programme plan, which then led us on to planning each focus session with the project team and the specific key delivery partner. The project team consisted of us at Waits, Powell Dobson, the Tier Collective and Council, Cardiff Council Development and Regeneration Department. We were able to explain all about the different types of buildings that would be built on site. And we were able to share and discuss with everyone the different outside spaces that we were looking for ideas for. The focus sessions were led by our key delivery partners and supported by the project team. And these included Isla from Grow Cardiff, focusing on community gardening, Ben from Sport Cardiff, who focused on moving more and making areas accessible for all, and the wonderful Marianne from Play Wales, who helped the children to explore the importance of imaginative play rather than relying on the traditional outdoor play equipment that can limit children's play experiences. So once everybody had had their focus sessions, they collated all their ideas and they were asked which of the 6 outside spaces they would like to work on. The Year 6 pupils from Pencaira Primary chose the Plaza. The Hillside Walk went to the Year 2 pupils from Pencaira. The community garden was taken on by the nursery children at the Ely and Cairo Children's Centre. The Green Walk were taken by the Year 6s. The Wild Wood area were taken by the Year 7s at Cardiff West Community High School. And finally, the Drainage Pond was taken by the Year 2 pupils at Pencaira. Here we've got a little bit of a snapshot of some of the photographs we took. The nursery children here are working with precedence imagery for one of the plans and mood boards that they made. Then there's Isla and Ezra out on one of the 2 site visits we had. It was very, very windy, and bless them, they managed to keep hold of their plans. Here's Mrs. Blackmore, who helped Jackson by scribing his ideas for his plan. Mrs. Powell and Year 2 children were investigating different play activities that they would like to try, and this led to discussions about what sort of space and equipment the site would need to provide to make this opportunity happen. Then we go on to Ben from Sport Cardiff, giving us food for thought when thinking about how people of all ages and abilities could move around the site in creative and different ways. We also discussed the use of technology and incentives for people to be active around the site. And then we go to the Year 7s at Cardiff West Community High School with their mood board that they created during their Grow Cardiff session at their school. This is one of the hybrid sessions, the next picture, where we had PRP architects in London, the Wheatley Road tenants in Wheatley Road, and all of the nursery and primary school children in person. Cardiff West had quite a lot of difficulties in attending some of the sessions in person due to lack of minibus drivers at school, and this was a knock-on effect of the continuous staff shortages down to COVID. However, we got around this by hosting a few extra sessions at their school. And finally, we've got a little picture there of one of our model making sessions. So once all the children had decided on their ideas for their chosen outside space, they made group models, and here are the nursery children from the Ely and Kyra Integrated Children's Centre. I'm going to try and get this to play now. Here we go.
Hi there, Sophie. We can't hear any audio, so you may have to, when you share your screen, slide the share audio tab.
Apologies.
Oh, perfect.
So sorry. I will just come out of this a moment. So sorry. Let's have a little look here. Include computer sound. This should be working now. One moment. Right. Let's have a little look now.
So we're here today
Thanks,
with
Sophie.
Isla. Give us a wave, Isla. Harper. Hello. Ezra. And Benji. Hi, guys. Now, you have been working so hard over the last few weeks, haven't you? And we've been working on the Michelson project. And you're going to talk us through all your lovely ideas for the community garden. The model that you've made in front of you looks very colourful. Can we please have Benji to talk about some of the things which are in your lovely community garden? Come on, Benji, talk us through it.
Some trees.
Some lovely trees. They look brilliant, don't they? Are they big trees or small trees?
Big trees.
Big trees. Fantastic. Ezra, can you talk to us about something else in the garden?
I don't know.
You don't know. Okay, Harper, what can you tell us about your wonderful garden that you've made here?
This is my pink lollipop tree, tree.
Okay.
And that's my birdie house.
And there's a birdhouse, which is here. Okay, lovely.
It's that thing.
Oh, that's a very nice tree, isn't it?
I built that.
Okay, that's good. That's good. Isla, can you tell us something about the community garden? That's a lovely tree as well. What's that blue thing in the middle, Isla?
Waterfall.
It's a waterfall fountain. Oh, beautiful. Okay, so what else have we got? What's this orange thing here?
A line.
A line. Is it? It's a path. Well done, Benji. Lovely work. Right, what else have we got? We've got some lovely little trees there. And then, oh, is that a play park, I see?
And I done that one.
You did that one on the end.
I done
Fabulous.
that one and that one.
You worked very hard then, Isla. Yes?
And that one.
And you. And I can see here we've got a lovely seesaw. We've got a fabulous slide as well. And are those carrots I can see?
Yeah.
Yes. We've got carrots and some other vegetables growing there in the veg patch. Wow, guys, you have created the most amazing community garden, and I cannot wait to see what ideas we can take from this to put in the real one. Yeah? So, have you enjoyed your model making?
Yes.
Yeah? Can we get a thumbs up?
Yeah.
Fantastic. Well done, team.
So the outcomes of this project have been extremely positive. The ideas everyone came up with were well thought out, and they could realistically be incorporated into the site design in time for the final planning submission. There are direct links between the plans and the reports used during our planning process and the ideas that were born during the project. As I mentioned earlier, the Wheatley Road tenants experienced reduced involvement due to COVID, as well as a misunderstanding around the reason why we asked for the input. But by the end of the project, they were fully on board, and we had a wonderful virtual session with them to get their thoughts and ideas on the community living element of the site, which is a development for people over the age of 55 or with disabilities. They also gave us plenty of ideas for the wider site, and their vision for the area was extremely clear, and without any prompting, it actually aligned beautifully with the children's ideas, especially around the nature elements that they wanted to include. The other nice thing about these sessions was that the children we could open the children's eyes wider engagement projects once the site has been fully approved by the council. So here we've got a bit of feedback from the teaching staff and pupils involved in the project, and I think that the quote that I really like is Sam's quote from Penkyra. I like seeing all the different places on site and seeing what we can do to change things for the future. So onto a roundup of the figures for the whole project. There were 16 young people involved in the sessions, a total of 7 older people engaged with us across the project. The project team and key delivery partners gave a combined total of 105 volunteering hours, which has an accumulated value of 5,775 in added social value. This was calculated using the National Themes, Outcomes and Measures, or TOMS as they're affectionately known, which is a standard tool for measuring social value. Again, using the same tool, I calculated that the value of preparation and planning time came in at £2,062.50. And we were very conscious about using recycled materials for our model making sessions. So Louise, our landscape architect, put us in touch with the Recreate Scrap store in Cardiff, and we were able to use materials from there. One of the other costs that are incurred was through Grow Cardiff. Now, they are a fantastic organisation who deliver meaningful and worthwhile engagement all over the city for a range of different demographics. Due to their high demand, they actually have to charge for their time. And the sessions they delivered were fantastic, and the price they asked for was worth every penny. The last costs we incurred were for printing of drawings, big plans from which the children worked, and these came in at roughly £50. So with all those outgoings totaled up, we spent the princely sum of £392.40, which for a 10-week project equates to just under £40 per session, which I think is really good value. Our next steps, so we're going to look at the design team have been given all of the videos and photos of the children explaining their models and written descriptions of what we'd like to be considered for inclusion into the final design. Once they have worked their magic and put as many of the ideas in there as possible, they will be submitted for planning approval. And then the plan is to meet with everyone who took part in the project and give them a breakdown of what has been submitted. And then once it's all been passed, we'll have a final session to celebrate which ideas have definitely been included in the Michelson development. And one last word, I think Benji's top sums it up quite nicely.
Thank you very much indeed, Sophie. That was a fantastic presentation, and I absolutely loved the video there and seeing the children's involvement and engagement. Brilliant. Well, we're going to turn now to questions, and I have just noticed there is just a quick question for you, Sophie, in the chat, just in relation to whether the community engagement extends beyond the development phase. So I'm going to suggest maybe you want to answer that in the chat section, and we'll pick up on some of the themes that have come through from this morning, because I think one very clear theme has been the importance of transport in enabling health and well-being through all of this. But I do want to turn just to the first question, really, which is around some of the lower hanging fruit, really, and it's a question that I'm going to come to Michael and Liz first of all for their thoughts, because we've heard quite a bit about hot food takeaways from Lydia's presentation, and whether we can move beyond things like that, things that are the sort of low hanging fruit, and whether planning policies can address issues outside the perceived jurisdiction of the planning policy. Who wants to start us off on that? Maybe Michael.
Yeah, I mean, it's a very good question. I guess my view is any fruit is good fruit in this agenda, because in a way, you know, anything makes a difference in their own way. So, but I do agree that there's been a lot of focus on hot food takeaways, but not a lot on other things as well. I guess my kind of key point is, I think public health is trying to find the value that they bring to the planning system. And many of the things that we are talking about today, active travel, natural environment, actually there are a lot of people working in this agenda already. So where does public health fit into this? And actually on obesity, for example, if you take a whole systems approach, then tackling the food environment is one fruit that you want to pick as much as you can, and then others will deal with it. I guess, my kind of final point is I think planners in some ways were bounded by the legal system, but there are ways that you can use the system to good effect. And people always mention barriers and challenges to doing stuff, but at the same time, there are councils doing great work using the existing system. it comes back to Tim's point and my point as well about, in some ways, it's not about policy, it's about people. I think people need to understand that they have a greater moral responsibility to the agenda than just what's within the planning law. So, and that's where the Royal Town Planning Institute and other professional institutes come in and actually, can inspire and upskill their professions to deliver positive change than just say we've framed very tightly around the planning law, because planning law can always change, but your morality and things shouldn't. And so that's where, we come into planning for healthier places, better places, not to adhere to just planning law. So that's what I would say. Thank you.
Thanks, Michael. Liz, would you like to add anything to that?
Yeah, I agree with Michael that, and like you said, any low-hanging fruit is good fruit, and and any advances that we can make together, I think is very helpful and collaborative. And I think that is the way that, we're going to have to think through the lens of both public health and spatial planning. Michael's right. There are constraints that, that public health professionals need to understand, that planning policy professionals are under, and they can only work within that. But some of this is about that wider political context. So in Wales, we've got the Wellbeing of Future Generations Act that can give all of us those levers to work together to create healthy spaces and places. And I think if we can, as public health, can provide evidence to support some shifts in thinking and changing and raise awareness of the importance of health and well-being and inequalities within the spatial planning system, because of course health isn't the aim of the planning system, but it is an important outcome and is integral to it. So I think some of this is about the raising of the awareness as well, in order for us to get more and more gains as we evolve and go forward.
That's great. Thank you very much. Whilst I've got you both on the screen, do you want to pick up on the question that's come in from Mark around equity and how different dimensions of equity might be recognised within some of these approaches? So racial equity, gender, etc. Who wants to start us off on that?
Liz, I think.
Yeah, I was going to say, funnily enough, talking about the book that Michael, myself and Carl Petruskovsky have just finished, equity and actually focusing on some of these dimensions was raised in terms of actually the planning system can affect the health and well-being of, for example, women and girls are mentioned. If you're or even at a basic level a parent, we talked about child-friendly. So it's about how I think we make those things explicit. And, you don't want to burden people, because it can be seen as a burden when you do things like impact assessments that will unpick those equity issues, but it also demonstrates how important it is that you think through those lenses. Michael?
My one point is just to say, planning is about planning for people, and actually it can be a population level lever, but at the same time, like many of the examples we've heard today, planning can be very explicit about delivering for certain population groups. And I think we just need to move beyond creating generic developments, and there should be more kind of open to different people being involved in the process, but also building different products, housing products and other things to meet certain needs. So that's what I'll say, really. Thank you.
Yeah, thank you very much for that. Tim, I want to bring you in as well, if I may. And I think there was a question for you in the chat around whether there were any comparisons between children's health and well-being during COVID lockdowns from the child-friendly cities versus cell-type cities. I think you may have put something in response to the chat, but is there anything that you want to kind of expand on? And maybe we can also ask you to respond to the question about whether you get it right for children, you also get it right for other population groups, that sort of stealth idea or the indicator species.
Okay, firstly, I just have to say our next door neighbours are having some building work, and there's some pneumatic drilling going on right now. I hope it's not going to mean that you can't hear what I'm saying. And I'm going to press on. Challenges of working from home. I don't know of any formal research on kind of comparisons between different cities or cities maybe with different sort of spatial qualities and kind of reactions to COVID. I know there is some interesting stuff going on in some high profile cities that are taking the opportunity, if you like it, opportunity or the circumstance of the pandemic to do make some radical changes to their streets and public spaces. And two that come to mind are Paris and Barcelona. And it's really interesting that in both of those cities, one of the most prominent changes that's happening is a real expansion in this sort of school street model. So this is, you know, restricting traffic in the streets outside of schools to encourage walking and cycling to school, to cut levels of pollution and to make those streets more convivial places. So both Barcelona and Paris are running schemes with hundreds of schools, which I think is really striking. And actually, I also think it's an example of that, using the child as a catalyst. And once, you know, the children and the idea of making places work for children can be a sort of symbolic act for making that makes a stronger case for bigger changes. I think the idea of if it works well for children, it'll work well for everyone. I mean, I think that some people on this call will know of the work of 880 Cities. So this is an international NGO based in Toronto, and the idea is behind the 880 is look at how a city is for an 8-year-old and how it is for an 80-year-old, and you'll create cities that work better for everybody. And I think that my sense is that's broadly speaking true. There may be some differences of detail. Facilitating the conversations that get people to that point, particularly sort of intergenerational conversations, I think is a challenge. But I'm just reminded of the quote from Gill. So Gill is Enrique's brother. He used to be head of parks in Bogota. He set up 880 Cities. And one of his quotes that I like the most is where he says, we have to stop designing cities as if everyone was 30 years old, male and healthy. So I think that's the critique there. It's that bringing children in, bringing older people in helps to move away from the sort of existing norms that really focus very strongly on, frankly, privileged groups in society.
Thank you very much, Tim, for that. That's a fantastic quote. We have had some other questions that have come in. I think they were a little bit more factual around Section 106 agreements, etc. And I think Michael's made a link available in the chat there. There was also another question around whether some forms of development shouldn't be allowed based on the impact on health. And I'm going to ask our presenters for their thoughts in the chat bar if we could, because we are running out of time, and I do want to make sure that you get a decent break this morning, because we've been going now for an hour and a half, and we haven't given you any comfort break time. So can I say a huge thank you to all our speakers this morning, to Michael, Liz, Lydia, Tim and Sophie. You have given us enormous food for thought and kicked off the morning's deliberations in fantastic style. All of your presentations will be available after this conference, so we'll share those with you. But thank you very much for all of your contributions this morning. We're going to take a break now, and after the break we're going to go into our 2 workshops. And those are very much framed now within the Welsh planning and public health context. So if anybody from outside of Wales wants to leave, we won't take that personally during the break. But if you are leaving, can I just say a huge thank you for your attendance this morning and all of your comments in the chat. And we very much look forward to those of you who are staying to join us for the workshops coming back after the break. We're going to come back at 11:15, so 11:15. And can I just ask you to remain in the meeting, so we don't need to bring you back in at 11:15. Just switch your mics and your cameras off and come back for 15:15. That would be great. So thank you very much to you all, and we will see you in 1/4 Diolch yn fawr iawn, a welwch chi gyd a chwarae wedi 11. Thank you very much.
Thank you, Kate. Thank you.
Thanks, Kate.